Hello and welcome to the Imprint Weekly Podcast. I'm John Kelly, Senior Editor of the Imprint, a daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at the Imprint News. You can also sign up on our homepage for our free weekly and monthly newsletters. And for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business policy and practice. The Imprint Weekly Podcast is also a member of the Safe Camp Audio Network. You can check out our show page and all of Safe Camp's other great podcasts at safecampaudio.org on the web, at SafeCampAudio on social media. All right, so we are a bit in summer mode here on the old podcast. I'm actually on a little half work, half vacay trip out east from my home in Detroit, going out to do some biking. I was in Ithaca, New York, in Connecticut to see some friends and family, headed up to Lake Sunapee, New Hampshire, but also along the way recording some interviews for a very cool podcast project that we will probably release in, I'm guessing, early 2026, so stay tuned on that one. Since last week was one of our kind of scheduled dark weeks for the 4th, I'm going to do a quick headlines edition today, and then we will have two guests next week to dig in deeper on something that I'll briefly talk about today. Then at the end of July, my colleague Ivory Bennett's show, Interviews, is going to be up on this channel on the 28th. And then we have some really great guests locked in for August as well. We have Michael Tanana from Listen to talk about AI and social services. And then we have two interesting authors. We got Gretchen Sisson, author of Relinquished, to talk about adoption in the context and in the wake of the Dobbs decision that overturned Roe v. Wade. And then we have Claudia Rowe, whose excellent book, Wards of the State, recently came out. It is truly just a fascinating look following several young people who, experienced foster care, aged out of foster care, and sort of the trajectory of their lives and their experiences. So look forward to featuring those guests for you towards the end of the summer. Okay, so like I said, just a quick kind of newsy, headlinesy summary day for the podcast, and just talk a little bit about some of the things that I'm seeing happen out there, some of the things our reporters at the Imprint are reporting on and whatnot. And of course, we'll start with the passage of what was once called the Big Beautiful Bill. I think it got changed to the Act in the final minutes of it. This is a reconciliation bill that was sort of accepted by the Trump administration, kind of carried out first in the House, moved through quickly to the Senate, who sent it back to the House. And despite a lot of storm and drum and opposition early on from some people saying they may not vote for it, pretty much everybody did in the Republican Party. And now it is law. So what is in this thing? What are the final parameters? I think we'll be learning probably just as the nature of some of these big bills that kind of get slammed through Congress. This is certainly not the first one like that. We'll find out little nuts and bolts that maybe people missed. The big things for the fields of child welfare and youth justice and just human services in general. And before I kind of go into a little summary of that, I would highly recommend that instead of just listening to me, you read our excellent reporting on this. We have all of this stuff kind of in a collection that we're just calling Trump Watch that covers all of the, furtive actions going on with the size of government that the administration is doing, and also with the taxing and spending policies that they're putting forth. But in a nutshell, the big ticket items that have garnered a lot of attention are, of course, the very sizable cuts to Medicaid and the also sizable cuts to the Supplemental Nutrition Assistance Program, or SNAP, which some people would just still refer to as food stamps. Okay, so when it comes to the Medicaid program, which we have talked about quite a bit in these last couple of months, because we knew that this was coming with several of our guests, including Zach Galeris from the Child Welfare Wonk and Alex Briscoe. I'll drop some links to those great interviews in our show notes for this. So if you missed them, definitely check those out. The main way, or one of the main ways in which this bill seeks to rein in spending on Medicaid, or at least change the policies around it, is to put work requirements for Medicaid on quote unquote able-bodied adults. Now, the House version of that would have basically just held parents of children entirely out of that. So with that bill passed, like I was talking about before, it went over to the Senate. The Senate had a different idea. They wanted to include parents with kids who are 14 and over in the work requirement section. It is worth noting that both the House and Senate had a provision in there that holds current and former foster youth up to the age of 26 out of this equation. So to be clear, just any young adult who aged out of foster care is between the ages of 18 and 26. That is a group that, per Obamacare and the Affordable Care Act reforms, is categorically eligible for Medicaid through age 26. They are held out of the work requirements for Medicaid. But now parents of children who are 14 and over will have to live up to those work requirements if they want to keep Medicaid. And part of it is actually working, although there is a provision that enables you to not only work, but be trying to gain a career skill or even volunteering. More important in terms of the gatekeeping process of Medicaid eligibility is going to be the paperwork involved. So that is certainly something to factor in here. It is a work requirement, but it's also a requirement to continue to prove that you are either working or volunteering or learning a skill for 80 hours a month. And I believe you have to do that pretty much every 6 months. Okay, so that work requirement in Medicaid is slated to kick in 2026, which I think a lot of people, are suspicious that times up with the midterms. That, very well may be true. I'm not in on the politics of all that. Certainly, it's a good thing that it didn't kick in right away, because this is something that states are basically having foisted on them. I mean, it's going to be the states that have to patrol this and make sure that there's a process in place to ensure that people are able to prove their employment status and things like that. If that got turned on, at the beginning of the fiscal year this year, there's no way any state would be ready for that. So that's Medicaid. The Supplemental Nutrition Assistance Program, or SNAP, also includes new work requirements for non-disabled people, who include parents with children over age 7. And unlike the Medicaid provisions, this work requirement does apply to former foster youth. There was an effort kind of at the last minute, where all the horse trading was going down, to shield former foster youth from the work requirements around SNAP, but that failed. So that did not make it in. And all former foster youth who are not disabled will have to be able to verify work or employment or volunteering, some sort of, basic civic participation, I guess, in order to retain their eligibility for SNAP benefits. And there was one huge difference, at least in timing, we think, between Medicaid and SNAP when it comes to these work requirements. And that is, it's not entirely clear from the bill when the SNAP work requirements take effect, but per our Michael Fitzgerald's reporting on this, which I will link to and you should definitely read, there are a lot of advocates and analysts that believe the interpretation, the correct interpretation here, is that these will take place immediately, which means as of October 1st, there's going to be work requirements for SNAP. Some other things that are in this bill that will certainly impact, people who are already involved with the child welfare system or youth justice or just families in general. There is a increase to the child tax credit. The House version of this bill was going to kick the child tax credit from $2,000 per child up to $2,500 for the next 4 years, and actually then stake it to inflation. The final bill sent over by the Senate and signed by President Trump only brings that up to $2,200. And unlike the sort of expanded child tax credit from the Biden administration during the COVID emergency, this is not one that is refundable to the point where, low and no income earners, or the lowest income earners, would be eligible. So there is still that sort of barrier in the child tax credit where if you're not making any money at all, your kids are not eligible for it, which, I think a lot of people, looking at the experience of COVID and the expanded child tax credit, where we did provide these tax credits to pretty much every family with children, and we did that in an advanced way, so they got actual payments instead of waiting till the end of the tax year. That really drove down the supplemental poverty index for quite a few years there. The Center for Budget and Policy Priorities estimates that about 17 million children are left out of the credit every year because of those income requirements. So that's one thing that's in the bill. The adoption tax credit made it to the final version. So there's been a long kind of push to have federal tax credits refundable here in this space for people who are adopting, which means it can be received as this refund if a person doesn't owe taxes, or if, the tax credit exceeds their tax liability. And so this bill is going to make that tax credit for adopting refundable up to $5,000. And that is also pegged to, the amount of inflation as well. One other thing from the bill to call out, when we kind of went through this after the House version on the podcast, I mentioned there was something called MAGA accounts that was written into this, which is sort of like a version or kind of like take on baby bonds. The idea is that there is this newly created, tax advantage vehicle whereby you can put money away for children. They can't draw it down until they're 18. There's a pilot program for this that basically, guarantees a federal government contribution of $1,000 per child born from, I think it's January 2024 all the way through the end of 2029. So it's a pretty substantial program with this pilot that's just going to basically provide that $1,000 universally to, American citizen children who, you have a social security number for, and you can prove that in that way. The name of it changed from the MAGA account to the Trump accounts. So that the name changed. I don't think anything really changed except kind of one big significant thing, which I'll get to in a second, about the structure of it. Like I said, there's a federal pilot that just kind of is going to provide $1,000 per child to everybody that claims it for their child through 2029. Employers can kick in, I believe, up to $2,500 a year for this, and that comes off the top. So it's kind of tax deferred for a worker. Parents can contribute $5,000 per year. When this money comes out, whenever a child turns 18 or older and wants to make withdrawals from it, it is taxed as ordinary income. But during the time that the money is sitting there, it is tax deferred and advantaged. The big difference, unless I missed it in the final, I read a couple times back just to make sure that it wasn't taken, that it was in fact taken out. The House version of this would have enabled other entities to make contributions to kids, but they had to do it in a universal way. So what I'm talking about there, and I believe these were all kind of specifically named out in the House version, think of like a foundation that wanted to, for, every kid in the state or every kid in the county that they focus on, to provide money into MAGA or Trump accounts. That would have been doable. They basically just tried to write it so that there was no way to be selective. Like you couldn't pick just kids of a certain race, or I don't know what. I think that maybe was actually the complicating factor, is because the universality is kind of a hard thing to nail down unless you're truly saying just every kid in the country or every kid in the state. So that got taken out. So if I'm reading it right, really it's parents and relatives, I guess, that could kick in, employers, and that's kind of it. Nevertheless, we are talking about a program whereby every kid in the country is promised, or every citizen child in the country is promised $1,000 from the federal government. So, I do expect and hope that advocates will make sure that there's a campaign to ensure that all families know to go and claim that for their child. Because, you just think about compounding interest at like 8% or whatever it would be over the course of 18 years, even that 1,000 turning into 4,000, if you never contributed another penny to it, is free money to help them do whatever at age 18. Just to wrap it up on this bill, two thoughts on the big enchilada here, which is the Medicaid changes. One thing just on the work requirements to start with. And, I welcome everybody's feedback on this. Shoot us an op-ed, shoot us some thoughts at tips@imprintnews.org if you have some takes of your own. On the work requirements, the precedent that we have seen that I think has a lot of people rightly concerned is the experience of Arkansas, who implemented work requirements, and it really has shown no evidence that they've successfully moved more people into the workforce with that enticement of having to work in exchange for eligibility to Medicaid. They have not seen an increase of participants in the workforce as a result of that. The other one is Georgia, who didn't quite do it the same way. I mean, they basically have not expanded Medicaid. So you were basically purely enticing people to work in exchange for Medicaid, if that makes sense. So basically, like, Arkansas changed their rules. They had expanded Medicaid, and they were saying, now, in order to continue to get Medicaid, you're going to have to work. Georgia's was more, hey, you group of able-bodied adults that are not currently eligible for Medicaid, if you can prove that you're working or volunteering, we will facilitate that. And they didn't really have the same, metrics as Arkansas when it comes to like work participation, but what they did see was a huge cost in terms of doing all of the work associated with, verifying work records and things like that. So anyway, I'm sure that those two states and their experiences are a big reason why people are worried that this is going to be a nightmare, around the country, and that it won't be that people aren't working. The vast majority of people who are receiving Medicaid of any kind are working. It will be the paperwork, it'll be the process. And I'm just going to keep, and I don't know if this is optimistic or not, for some states at least, but you're thinking of two states there who came into this with the mentality of using work requirements, at least to some extent, as a limiting factor. And that will not be the position and mentality of most states. I don't think that California, for example, or plenty of other states in this country will be, coming at the process of figuring out how they're going to do work verification from the mentality of like, how cumbersome can we make it? I think they will be coming from it in the opposite direction. How can we make this extremely seamless in such a way where we will not lose a lot of people their Medicaid coverage? So maybe I'm being Pollyannish about that. And who knows? I mean, I guess it is possible that the administration could write the regulations around the Big Beautiful Bill Act, whatever it's called, in such a way that these states have to be onerous and have to be burdensome to people and how they prove it. I hope that's not the case, because that truly would just be superfluous and mean to do it just as an exercise. But we'll see. I'm interested to see if states can be innovative or agile or whatever adjective you want to use for government to make sure that it's relatively easy to just simply prove that, yes, I am working, yes, I am volunteering. So we'll see on that front. And then the other thought I had was really just, there's an obvious straight line when you're talking about parents having to do this work to prove work requirement. That's like, okay, these are people with kids. This process may jeopardize the eligibility of some of them to continue on. And that obviously is a straight line to making families more vulnerable, potentially opening them up to child welfare involvement, et cetera, et cetera. So that's kind of like the easy straight line to see. My sense is we're not going to really know for a year or two, like exactly what the impact is going to be of these Medicaid cuts, because at the end of the day, it is really going to be the decisions that states have to make as a result of like the net cuts to Medicaid. And it may not even be that the main, things that go away or the things that we see vanish when it comes to the safety net for kids are in Medicaid. I'm just thinking, for example, of, there's another piece of this Medicaid cut puzzle in the bill that has to do with the way that states can tax, hospitals and and medical providers, which is tax revenue they use to do the state match for Medicaid, which they have to do. It's a matching program between federal dollars and state dollars. So that goes away. And then you have a more laborious process that you're going to have to do to, approve work requirements and things like that. These things are going to come down to states in a way where, it's not knowable right off the bat just exactly what loss of federal money they're going to have to make. But it's also not like for sure that is going to mean they politically will be behind cuts to Medicaid. And if you're not going to cut Medicaid when the federal share of Medicaid is going down, you're going to have to cut somewhere else unless you're willing to take on a deficit or find new tax revenues. So I think that my point, and I know I'm being kind of meandering here, is this is just in a way, it's sort of a ticking time bomb being placed into state budgets. And I've talked to a number of people who know state government who agree that it's just like, we don't know until these guys have their, internal forecasts for what their budgets are going to look like in this year or the next fiscal year, and really have to say, okay, what do we have to take off the table to keep Medicaid, funded at the level they're not, or make hard choices in Medicaid. The point is, I just don't think we know yet what is on the table for cuts. And I think that next year, we're going to see a lot of very fraught, painful conversations and things on the table when it comes to state budgets. So that's the big budget bill. We've talked on the podcast before about some of the things that the Trump administration, kind of led by the Department of Governmental Efficiency, or DOGE, has been doing with the discretionary funding that it is sort of supposed to be giving out for fiscal 2025, which is in last year's spending agreement. One of the things that we had talked about was some 360 grant awards from the Department of Justice, which included a whole lot of grantees that focus on kids and youth justice and things like that. I think it's like $800 million in total of grants that come out from the Office of Juvenile Programs that were pretty abruptly terminated in the spring. Like many things that are going on with the sort of nexus between federal government and DOGE, there were lawsuits about that. And a federal judge, U.S. District Judge Amit Mehta, last week denied a preliminary injunction that was sought by several organizations who had lost their grants, and granted a motion by the federal government to dismiss the case. And it was, pretty compelling that Mehta called the department's actions shameful. He said defendants' rescinding of these awards is shameful. It is likely to harm communities and individuals vulnerable to crime and violence, but displeasure and sympathy are not enough in a court of law. So essentially found that his own court did not have standing, and that they had, and the plaintiffs had not really proven any sort of constitutional violation. So those grants appear to be going towards full termination for this year. We have asked the Department of Justice for a list of grantees who have successfully appealed and actually gotten their money. We were told that there was going to be a process for that to happen. They have decided not to comply with that request and provide us with a list of organizations that thus far, of those 360, and within that, of the ones who are working on youth justice, how many of them have actually gotten their grants back. So that's going away. On the other hand, another judge restored AmeriCorps cuts. I think we talked about that last time on the headlines for the Imprint Weekly podcast. So these court decisions are kind of going in different directions, but those are all dealing with grants that were already awarded by the Biden administration for fiscal 2025 before Trump was inaugurated. I would say that now the advocacy around federal funding for youth is turned a bit towards angst over the grants that they have in their power to do the competitions for and hand out, and whether or not those grants are going to get made. There was the freezing of a lot of education grants. I want to say like $6 billion in grants towards the end of June. That money is still tied up. Basically, the administration said, we're not going to put it out. We're going to review these grants to decide whether or not we're going to do them or not. So that's already happened. And here's the thing about, the federal government and its process that I think has everybody worried. The fiscal year runs from the end of September through the end of September. So September 30th is the end of the fiscal year. Fiscal 2026 is going to start in October 1, and then fiscal 2026 is going to end on September 30th of 2026. So we are about, I want to say like 75 days, maybe a little more than that, away from the end of the fiscal year. And generally, it takes until spring generally for a lot of the notices of availability for federal grants to come out. Then usually have about 2 months for people who want to apply, whether that's nonprofits or state governments and things like that, to put in their applications, to do all the materials that you need to do to report to the government in order to compete for the money. And then that's really the beginning of the process when it comes to what the feds have to do, which is, internally review things, have peer reviewers who can help them decide who are the best candidates, and then to actually announce the awards and obligate the money, which would be like start sending the money to the grant winners. And I think the big concern is with 70 days left, it's just becoming less and less likely that you could actually do all those things. And there's just lots of funding notices that haven't even been published yet. To give you an example of one that's kind of has come to fruition here a little bit, there's a program that's called like the Runaway and Homeless Youth Act programs, and it's part of an agency within the Administration for Children and Families, which is in itself in the Department of Health and Human Services. So these are grants that fund, shelters, transitional living programs, maternity group homes, and then street outreach for providers who are out there really on the front lines helping to try and keep kids safe who are out there on the streets, at risk of being sexually trafficked, labor trafficked, and all of the horrendous things that can happen when you're out there as a runaway or a homeless youth. And, until last week, there was no knowledge by anybody, in that world, including the advocates who kind of sort of champion those causes and those programs on Capitol Hill called the National Network for Youth, about where the heck that the competition notices were for that money. And it's not all of the money. It's like $146 million a year that goes to runaway and homeless youth. A lot of that is tied up with people who are in their second or their third year of a grant. It's really just the ones who are competing for either kind of renewal or for a new grant who were sitting around waiting like, where the hell is this notice? Because I really want to submit my materials and hopefully, work with kids who are on the street. And so, it kept going, no notice, no notice. Finally, last week, they posted the competition and they had, these providers have about 2 business weeks, maybe like 14 days to get their materials in, with the hope that that will leave enough time for the federal government to even do a sane process to decide who's going to win. So that's really putting a strain on, these providers for sure. Also, there was sort of an announcement made kind of in advance of these notices coming out that street outreach would no longer be its own thing. It was going to get rolled up into all the grants. And so we will talk to, some folks who are involved in street outreach about exactly, why that's an impactful decision and what people should expect to change as a result of that. But this is an example where notices have actually come out. There's still plenty of grants, that were planned, both the Office of Juvenile Justice or forecasted at the Department of Health and Human Services, that still haven't even put a notice out yet. So we're running out of time for there to be some sort of grant process or competition. And I think people are really worried that there's not one coming for every one of these grants. Certainly that would be the indication, and the subtext in what they did with the education grants. It seems like they're not sure they want to even compete it. And so that brings people to this kind of legal question around, is that a way that you can sort of, if you don't want to spend money, get away with it by just running the clock out and then putting it back in the treasury and saying, well, we just didn't have time for this year. And I think people are pretty worried about that. All right, so that's sort of what's up with the federal funding picture and what's going on Capitol Hill. Just wanted to talk through also just a series of stories we've been working on here at the Imprint over the summer, and then call attention to something that really surprised me that was very interesting out of New Mexico that we have not yet written about, but I do expect that we'll have eyes on pretty soon. All right, so the series I'm talking about, in January, the Imprint reported on a landmark study, foster care entries that the federal government did, looked at foster care entries between February of 2017 and 2019, and it found that a significant number of youth entering foster care each year did so because of behavioral health issues that parents are struggling to address. So not parental behavior necessarily, but behavioral health of children that parents were having a tough time with. And the study found that, and I'm quoting here from their findings, as many as 25,000 foster care entries, or 5% of all foster care entries, might have been instances of custody relinquishment. So in these cases, abuse or neglect by a parent didn't contribute to the entry. It was the child's behavior that did. So we've begun to kind of report further on this phenomenon in states where, we have staff reporters and in some cases have gotten some freelance help. And I just want to, in the show notes, link people to some of the early reporting that we've done on this, because I think it's really interesting and really kind of shines a light on sort of a under-discussed corner of this field. Just by way of example here, I'll call out a few stories that we've already done in Texas, where relinquishments like this account for 6% of foster care entries. Lawmakers have pursued ways this year legislatively to offer more mental health solutions early on to avoid these situations. Child welfare advocates in Texas say parents seek this route, believing that Medicaid, the state and federally funded Medicaid and medical insurance that we just talked about being cut just about 20 minutes ago on this podcast, will allow their children access to treatments and resources that they haven't been able to attain. So surrendering your kid to foster care with the expectation that, they will be able to use Medicaid in a way that you can't to get these kids the help that they need. But, per our reporting on this by Sarah Tiano, professionals working with these families in Texas really warn them that this pathway rarely leads to children getting the help they need. In fact, in Minnesota, we worked with a reporter named David Dudley and found through, specialized data that the state was able to provide for us that of 4,166 new entries into out-of-home care, almost 12% of those involved parents who sought intensive mental health treatment for their kids. And then finally, in Michigan, the state Supreme Court recently ruled that the child welfare system has erred in finding a parent neglectful for seeking to surrender their child. So this is something that the state Supreme Court took up, and I'm just going to read from Justice Megan Kavanaugh on this decision. Parents who have gone to great lengths to help their mentally ill children, but who ultimately exhaust the resources at their disposal, should not suffer additional legal and collateral consequences. And she suggested to lawmakers to create what she described as a no-fault pathway for such parents who are forced to turn their children over to CPS because everything else has failed. So, I think in totality, what I would say is just generally, this is something that, as we begin to report on, it's clearly on the minds of lawmakers and clearly winding its way through courts here in some states. And we're going to continue to report on this in other states. So stay tuned on that. And if you want to read our coverage out of Michigan and Texas and Minnesota, you can check out those links in the show notes for this podcast. All right, last thing here for this week. I said there was something I wanted to just sort of flag that was a fairly surprising kind of policy shift by one state, but I would treat it more as kind of a watch this space because I don't think they're the only state thinking about things like that, is this New Mexico decision by the Children, Youth, and Families Department to really do kind of an about face on their policy when it comes to children who test positive at birth. So they're born with some drug or combination of drugs in their system, but not every drug. So let me just read from the memo that they sent to Protective Services staff. I'm going to read two sections of it to sort of lay the groundwork for you. But just before I start, in a nutshell, what they are starting to do, and they attribute this in local media coverage to, it's basically a reaction to recent deaths of children known to the system, is basically making it the automatic policy of New Mexico to remove certain children, at least temporarily, from their parents if they test positive as newborns. So here's the two paragraphs to really focus on. Effective immediately, in an abundance of caution, we are moving towards ensuring the safety of children exposed to certain drugs. For all screened-in investigations involving children born exposed to methamphetamines, fentanyl, polysubstance, or diagnosed with fetal alcohol syndrome, the child must be taken into custody and an abuse neglect petition must be filed prior to discharge from the hospital. There will not be any exceptions to this requirement. I'm not going to read the entirety of the next section that I wanted to make sure to kind of call out here, but basically this has to do with how in those affidavits, when you're seeking the removal, it's basically instructions for workers on what to do in terms of discussing reasonable efforts. What they say here is that if the family has CPS history already, the reasonable efforts section of your affidavit should reflect the prior services involved in previous cases that were made. And if they don't have any prior CPS history, then the reasonable efforts section of the affidavit should, and now I'm going to quote from them, reflect that due to the serious nature of these types of drugs, the department is taking custody to ensure the safety of the child and to ensure that the parents will be court ordered to obtain necessary treatment to alleviate potential substance abuse risks, end quote. So that is interesting to me because basically they're saying in the reasonable efforts section, explain why you're not going to make reasonable efforts to prevent removal in this case. And just going back to the first section that I read, the thing to take away from that is this is just an automatic policy now. There does not appear to be any wiggle room. If there is a positive test of a newborn for these drugs, that it is an automatic removal, and that is how the case will begin, or at least it'll be an affidavit for removal. I guess the judge could decide otherwise, even though this is the policy for Children, Youth, and Families Department. So I'll just say a few things about this real quick, but I will link to some local coverage of this decision. And, you can expect that the Imprint will probably be looking into this as well. One thing that jumped out to me from just the language of the policy change was the lack of one word, which is opioids, right? We've heard quite a bit over the last decade and a half about the opioid crisis and its impact on child welfare and its influence on increasing the number of kids who entered foster care back in the 2010s. That's not in there. Fentanyl is, but that's still, it's an extremely dangerous form of opioid, but it is a small subset of the overall pie when it comes to cases involving opioids in the child welfare system. So the fact that it's not in there was really interesting to me. I guess polysubstance is sort of a catch-all. So I guess if you have opioids and alcohol in your system, if you have heroin and alcohol, that would subject you to this automatic removal policy. Methamphetamines is in there. And, I will say anecdotally, just in the many people I talk to, that there are states that have seen meth back on the rise as sort of a overall use rate situation in society, and also as a, portion of the child welfare system involvement in their states. The diagnosis of fetal alcohol syndrome is kind of an interesting phrasing. So we're not doing an automatic process, I guess, if you can detect alcohol in the blood system for a newborn, but if they are diagnosed at birth with fetal alcohol syndrome, that would subject them. I will say, I wasn't even aware that that's something you could do immediately at birth, actually do some sort of diagnostic process. I'd be interested in the validity and frequency with which that is done to kids at birth. That would be a new one to me. But I learn something new every day. So maybe I'm just way off about that. Okay, so just in addition to that, having read some of the local coverage, I think that there's, you read something like this and your immediate kind of leap is like they are moving from keeping families together to tearing families apart automatically in every case. And I think that is not the entirety of the picture. I think that certainly is the case in some situations, right? This will certainly probably lead to some children being removed who, but for this policy, maybe caseworkers would have left with their parent. But I think that it's actually more responsive to another situation, which is hidden foster care. I think that when you come up with a safety plan with a parent whose child tests positive for drugs, at least the drugs listed here, very often it's not a case that's going into the formal foster care system. It doesn't mean that they're leaving that child with mom. That kid could go to an aunt or an uncle or a grandparent, and the safety plan is for mom or the parents to get clean or work on their sobriety before the child is really coming home with them. And I think the concern is about the validity and the efficacy of these safety plans in every case. And so I think that has a lot to do with this. But like I said, it's kind of new to me. I was actually on top of a gorge, having biked up it in Ithaca, New York, when I got sent this and had a chance to read it. I did think it was just interesting enough to call out to our listeners here and, send us your thoughts at tips@imprintnews.org if you have them on this or anything else. That's going to do it for this week on the Imprint Weekly Podcast. We are a production of the Safe Camp Audio Network, which is a division of Fostering Media Connections. Please visit safecampaudio.org on the web or at safecampaudio on all social media. This podcast is produced and mixed by Christine Onjoko, with music by Luke Giroux and Cyrus Elliott. If you enjoyed this episode, we would love it if you would consider subscribing or giving us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. And we'd really appreciate if you would consider supporting our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow, cover more great stories in child welfare and youth justice. To support us, it is super easy. Just visit imprintnews.org/donate. You can follow the Imprint on Twitter and Facebook by searching the handle @theimprintnews and visit us on the web at imprintnews.org. You can always email us at tips@imprintnews.org. I'm John Kelly, and we'll see you next week.